Thank you, Mr Speaker. My question is to the Minister of Health and asks, does he stand by all of his recent statements on health services?
The Honourable Tony Ryall.
Mr Speaker, yes, including the announcement that the government has approved and funded a bowel cancer screening pilot that will cost in total $31.6 million over the next 5 years. Bowel cancer is the most frequently diagnosed cancer and the second highest cause of cancer death here in New Zealand. In 2007, almost 3,000 people were diagnosed with bowel cancer and 1,252 people died from this disease. This, though, is a cancer that, if diagnosed and treated early, Mr Speaker, people have a good chance of survival.
Dr Jackie Blue.
Thank you. To the Minister, what further details can he advise concerning the bowel screening announcement?
The Honourable Tony Ryall.
Mr Speaker, the final decision on which district health boards will be the sites for the pilots will be made following an expression of interest process, which is expected to cover a minimum of 60,000 people aged 50 to 74. This process will enable the Ministry of Health to assess willingness, capacity and readiness and allow a coordinated approach to planning and implementation. This is a long-awaited initiative which, if successful and a national program is rolled out, could over time save up to 270 lives a year.
Ian Lees-Galloway.
Given that we hear the Minister congratulate himself day after day for elective surgery increases, what does he say to Dr Clive Solomon, a surgeon operating at the front line, who said the Minister's figures were questionable and a blatant misrepresentation of health figures for political expedience?
The Honourable Tony Ryall.
Well, I would say he is wrong, because the simple fact is, I would say it was wrong. And it's quite clear we're heading into District Health Board election season.
The Honourable Luamanuvao, Winnie, Laban.
Thank you, Mr Speaker. My supplementary is to the Minister of Health. How can this House trust his so-called good news on health when each day my office is called by another older person suffering because of his health cuts? And that is why we are going to listen to their views, not his.
The Honourable Tony Ryall.
Mr Speaker, that member can recite that mantra as much as she likes. The fact is there are more services being provided at the front line in New Zealand every day. And if you look, for example, at the Capital Coast District Health Board, 500 more Wellingtonians got elective surgery last year than the last year of that failed government opposite.
Question number 6, the Honourable Marion Street.
Thank you.